Hello, I am Dr. Sanjay Gupta. I am a senior physician, consultant in internal medicine and diabetology, and I am practicing in Prima Diagnostics at Sarjapura Road, Bangalore. I have been practicing in Bangalore for the last 10 years and I have a large expanse of experience of 25 years. We are coming across this terminology called brain fogging for quite frequently, and this is mostly coming from the young, energetic people who have aspirations and who are quite busy professionals, and sometimes it can come from teenagers. So we are also subjective to a lot of social media knowledge and a lot of Google knowledge and a lot of word to mouth disorders, and sometimes I wonder that the brain fogging can be a misnomer when we try to actually tell that I am not able to think clearly. I mean, the word fog itself will tell you that the visibility is less. So what type of visibility is less in the brain when we call it brain fogging? Definitely it's a misnomer, but it also tries to tell you that the person sitting in front is trying to convey something which is going wrong with him or her in his life. So we can think about asking more questions, give them a scale of various questionnaires where we might come to understand that is it a cognitive problem, is it a orientation problem, or is it that the person is very tensed and very fatigued, or it is a overload of work. Because you might be wearing multiple hats in your daily life, right from morning till night. You are not just an office goer or a professional. You can also be a family member to your relatives. You have to do a lot of social work. You have social obligations. At the same time, you will also have to keep your sanity. So in such cases where you do actually multitasking, or you might have some expectations people are making you work for, you may not be able to come to that level. You may not be able to perform and succeed, and hence there is a possibility that you are going through a brain fogging. Sometimes, besides these problems of general life, what we also feel that you might not be well inside. Sometimes it is difficult to relate to the brain fogging with the problems going on in your body. For example, you might be a migraine subject, or you may have some acidity causing these problems, or you may have a bad taste for the food you're eating, or you may be not actually eating in time and sleeping in time, and all this can cause little disorientation, little bit of fogginess, what is used as nowadays. We might have to be very careful about this word and take a good history to find out whether we are dealing with psychosomatic problem or we are dealing with a pathology inside the body.